So you want to make a baby, and you're trying, and it's not working, and you don't know why. And your doctor has said to you, you have unexplained infertility. Then don't scroll up. Don't scroll up. Let's just talk for a few minutes about unexplained infertility. Yeah, it's a thing. I remember sitting right here in this chair, and across from me was a colleague, a female OBGYN. I thought she was going to kill me because I told her she had unexplained infertility. What is that? Well, what is it? It's a diagnosis of exclusion, meaning we have to rule out everything that we can figure out. And I follow my process of SCMS, meaning sperm, eggs gotta meet, gotta stick. So sperm, no major abnormalities. There's a tendency to pin the whole thing on, 3% morphology or 12 million sperm instead of 15 million sperm. Significant male abnormalities. 2, are eggs, so egg reserve, are you ovulating? And lots of times, the unexplained infertility there are subtle ovulatory dysfunctions, and the timing is an issue. M is, can they meet? So we've done imaging studies. We know that your tubes are open, your uterus doesn't have any major abnormalities. Throw in their issues inside the cavity, polyps, chronic endometritis, etc., endometriosis. And then, last but not least, can they stick? Meaning risk of miscarriage. And people forget that it's been shown or theorized that 85% of all human pregnancies fail. It's just that, 85% of every woman who ever found out she was pregnant, take that back. 85% of all women who conceive. Most of the women didn't know they were pregnant. Mess that up. So, in other words, what happens? They followed couples, and they did blood work, and the HCG went up and went down, and most of the time the woman never even knew she was pregnant. Maybe some subtle changes. So what's the point? Point is that you could have unexplained infertility, but you really don't. It's really recurrent pregnancy loss. So that has to be put into your thoughts. Unexplained infertility. What's the treatment? It's all very pragmatic and empiric, meaning we don't know what we're treating. So we want to do some timed ovulation to make sure we've got that right. We may want to take the sperm and put it up closer and do an IUI, put it in the uterus, sort of drop them behind the enemy lines a few times. Unexplained infertility. And the last but not least is the ART, and more advanced reproductive stuff, the IVF. And more recently, I started doing InfoCell with unexplained infertility. There are things that we can see and test. There are things that we can only see and test after we do or while we're doing IVF. For example, one of the reasons for unexplained fertility could be that when you take the sperm and you try to put it in the egg, right? Here's the egg. We want to put it in, and 16 hours later, see two nuclei, pronuclei, one from the sperm, one from the egg. So, we don't know if there's an issue between the sperm and the egg, and also, is there an issue of the embryos developing? So, unexplained infertility, you follow the algorithm of 3 COIs. Sometimes, if you're young, go longer. Controlled COI is Clomid, letrozole, and then there's inseminations. Would limit it to 2 for unexplained fertility. And at any point in time, if you want to go straight for where the big success is, that's when you just take the eggs and sperm, put them together, IVF. Now InfoCell, I'll do. Because we can tell on day 5 when we take the embryos out if they arrested on day 1. We can see it. Peace out from the Midwest, where we make babies. Fertility Partnership.